Hi everybody, we're going to pick up with blood typing. If you're following me in the course pack, I'm on page 29. A lot of great resources out there for blood typing. I highly encourage you to take a look at the Nobel Prize website. They have a fantastic blood typing game. The Red Cross website also has a great game, as does GetBodySmart.com. In order to understand blood typing with the ABO blood groups, let's first talk about some terms, antigens and antibodies. For starters, antigens are agglutinogens. In other words, they're antibody generators. That's where the word antigen comes from, antibody generators. These are proteins on the surface of a red blood cell. They can be something that causes agglutination or clumping if they're perceived as foreign. Antibodies are known as immunoglobulins or agglutinins, are produced by our body's own white blood cells to identify and attack foreign antigens. Let's go back and talk about the word antigen for just a moment. Let me use the flu virus as an example. The flu virus is perceived as foreign to your body. The first time your body is exposed to the flu virus, it takes some time for your body to identify that flu virus as foreign and to create antibodies to fight against that flu virus. These antibodies, however, will linger in the bloodstream at a lower population than when you were fighting the height of this virus. Now, a couple of years later, you're exposed to a flu virus that's similar, has a similar enough structure for your antibodies to bind and attack it. Well, you've got antibodies already present in your bloodstream, so the second time you're exposed and third time you're exposed, you'll have antibodies already made in circulation, and the response is faster and more fierce the second, third, and so on every time you're exposed. So that's how antigens and antibodies interact if you're talking about foreign antigens. Let me also mention that you do have your own self-antigens, ones that your bodies perceive as your own. I'm going to say my blood type is A negative. If I'm A negative, then the antigen that I carry is A. And so my body perceives that as a self-antigen, not as a foreign antigen. Foreign antigens are those that your body doesn't recognize as its own, and thus will fight with antibodies. Let me take you back to Bio 210 for just a moment. Some of these surface features seen here on the glycocalyx, which is the outermost portion of your plasma membrane, these surface features allow our bodies to recognize these cells as our own. So when we're talking about recognizing cells as self-antigens, we're looking at these surface features and saying, yep, we recognize this. There's no need to fight off this particular cell. So self-antigens are those which your body recognizes as your own, whereas foreign antigens, we don't recognize these surface features, and in that case, we will trigger an immune response. Let's talk about the ABO blood groups. ABO blood groups are based on two surface features on red blood cells. These two surface antigens are either the A antigen or the B antigen. If you don't have any antigens for the ABO blood group, then you are going to automatically have blood type O, which happens to be the most common blood type. If you have both antigens A and B, your blood type is AB, which happens to be the least common blood type. If we say you have the antigen A, that is automatically your blood type. You are blood type A. Or if we say you have blood type B, then you have antigen for that B. So it's what you see is what you get. If we say you have the antigen, that now is part of your blood type. The only way you can end up with O blood type is to have no antigens for the ABO blood group. Be sure you take a moment to pause this slide and jot down this information on page 29 of your course pack. Let's talk for a moment about the universal donor and universal recipient. The universal donor is technically a blood type that's able to donate to any other blood type. We typically call this blood type O. The universal recipient is also designated as one that is able to accept blood from any other person. We designate that as AB. Let me be specific here. When we're talking about blood donation, we might be talking about simply red blood cells being donated, or we might be talking about whole blood donation. So when we talk about whole blood, let's just talk about a test tube of whole blood. We know that whole blood is around 55% plasma and around 45% formed elements. And mostly those formed elements are red blood cells. So when we're talking about whole blood donation, we may also be talking about antibodies that are found in that blood plasma. So let's think about this for just a moment. If your blood type is O, then you may perceive A and B as being foreign. In fact, you may carry antibodies against antigen A and antibodies against antigen B. So we would say that in your whole blood plasma, you carry anti-A antibodies and anti-B antibodies. Do you see any problem giving whole blood of blood type O away to a person with blood type A? Well, yeah, you may be giving them a small amount of anti-A antibodies. When exposed to that recipient, those anti-A antibodies may clump or agglutinate. Just something to think about there. Let's talk about the universal recipient, which is AB. That means the person has antigens for both A and B. Now, if we were to give this person O blood, we might be receiving anti-A antibodies and anti-B antibodies. So there is a small risk of agglutination if we do some of these transfusions, especially if we're dealing with whole blood that carries along some antibodies. Let me give you the backstory here. Interesting to note that the anti-A and anti-B antibodies may be formed during your childhood, even if you've never had a transfusion. Through exposure to living in the world and animal products that we may eat, we eventually will form these anti-A and anti-B antibodies. So even if you've never had a transfusion, you may be toting around some of those antibodies. So just something to think about when we talk about blood donation. There always is a small risk unless you're getting your exact same blood type. But in emergencies, we're looking at picking out a transfusion that is the best fit. And of course, O would be a great fit for somebody because it's a universal donor and carries a smaller risk than, say, perhaps an incompatible blood type. So just something to take a look at here. You'll notice that type A blood carries A antigens. They call them agglutinogens here. Type B blood carries the B antigen or agglutinogen. Type AB carries both of those particular antigens on the blood cell surface, while you'll notice O lacks either antigen on the blood cell surface. Notice going down here along the bottom with the antibodies. Blood type A will carry anti-B antibodies. Let me caution you, if you just say B antibodies, it's easy to get yourself confused. I would force yourself to get into the habit of saying anti-A or anti-B antibodies. That way you're very clear and won't confuse yourself on what type of antibodies we're talking about. So the person with type A blood probably carries anti-B antibodies in their blood plasma. The B-type blood carries anti-A antibodies, these Y-shaped structures here in their blood. The only antigens the ABO blood group has is A and B. So that's why the person with AB blood carries no anti-A nor anti-B antibodies. Finally, the O person carries both anti-A and anti-B antibodies. All right, so this is what we were talking about. These immunoglobulins are antibodies. Immunoglobulin G and M are found occurring naturally in the blood of people. Anti-A is naturally found in those who have type O and type B, and anti-B is found naturally in those who have blood type O and A. So it is naturally occurring through the exposure to the environment and to animal products. That's kind of the history behind where the anti-A and B antibodies come from. Like to take a look here at an antibody. It is a Y-shaped structure with a particular fit here for the antigen. You'll notice there are two places for that antibody to bind that antigen. So if that antigen sits on one blood cell here And on another blood cell here, we call this cross-linking. That's how one antibody can actually bind antigens on two neighboring red blood cells. Okay, so that might be one, and that might be another. When this antibody binds a foreign antigen, we call this agglutination, and that is a problem because this clump can now travel through your capillaries, and unfortunately it's too large for a capillary, so it can rip a hole in capillaries and cause damage to an organ. Here you can also see antibodies binding antigens in this picture. And here you can see this antibody-antigen reaction. These Y-shaped structures here are our antibodies, and they are cross-linking between antigens found on two neighboring cells. So this makes quite a large clump here. What you're looking at is called agglutination. So just a caution about this word, we talked previously in this chapter about coagulation, which is the third step of hemostasis or blood clotting. Coagulation and agglutination are two totally different things. Agglutination that you see here is actually this process by which an antibody binds its antigen. All right, so just some main points to remember so far. If the antigens on the red blood cell surface are A, the only antibody we can build against it is an anti-A antibody. B and so forth, and then RH. We'll talk about that one in just a moment. Just one thing to note here, there are no possible antibodies against the O blood type. And why is that? That's because there's no antigens on the surface of an O blood cell in terms of the ABO blood group. There are other blood groups out there, but we won't talk about those. So just something to think about here. People with the blood type AB, that's AB negative specifically, makes up a very small percent of the population. AB positive people are potential universal blood plasma donors. The great thing about AB positive is this person carries no antibodies in their blood plasma. Why is that? It's because you've seen all the antigens for these particular blood groups. So AB blood carries no antibodies. So this is the type of blood you might want if you are, say, a burn patient and need a plasma donation. Red Cross has a great website that helps you understand donors and recipients and how this works. I do want to direct you there in case you want to play their game or walk through some of their animations on how blood typing works. We're going to do this together in just a moment. Once again, here's agglutination. You can see those antibodies attacking and binding those antigens. That is called agglutination. Keep in mind, coagulation and agglutination are not the same thing. Here you can see agglutinated red blood cells and their antibodies traveling through the capillaries. They can become quite a large clump, and that can be problematic, especially for those smaller vessels like capillaries. You can see an end result here is called hemolysis. That technically means the blood cell can rupture, hemoglobin can escape, and that can cause our kidneys to excrete whole hemoglobin into the urine. If you'll take a moment to flip on over to page 30 with me, we will now talk about the Rh factor, otherwise known as the Rh antigen, or alternately called the D antigen. Okay, so 85% of the population is what we call Rh positive. That means they carry that particular antigen on the surface of their blood cells. Only 15% of the population are said to be Rh negative, meaning they lack this particular antigen. So let me take a moment just to draw a red blood cell down here. And we're going to pretend that this little plus sign is the Rh antigen that we have on this red blood cell surface. So if you have that Rh antigen or D antigen, we say that you are positive for that particular antigen. So this person has Rh positive blood. Let's take a look at another red blood cell. This red blood cell has no Rh antigens, so I'm not drawing anything on this red blood cell surface. So because this person lacks the Rh antigen, we're going to say this person is Rh negative. So let's talk about it this way. If you feel really bad, you feel awful sick, and you think you might have the flu, if you go and you have a test that's performed and they come back and they say, hey, you're flu positive or positive for the flu, then you've got it, right? Same thing here with Rh factor. If you're positive, you carry that Rh factor. If you've had your flu test done and they come back and say, great news, you're negative, that means you don't have it. Likewise, Rh negative means you don't carry that particular antigen on the surface of your red blood cell. Let me also make clear that the Rh factor is a separate group of blood typing from the ABO blood group, so they have nothing to do with one another. They are simply two common blood types that we do discuss. There are others, but like I mentioned, we won't talk about them here. Where Rh factor becomes an issue is for those who receive a transfusion or are pregnant. So let's say that you are A negative. What does that mean? That means you don't have the Rh factor. Let's say that this person needs a blood donation, and so we come along with A positive. We're going to give this A positive blood to this A negative person. Well, A giving to A, no problem, right? Here's the problem. The negative person doesn't have the Rh antigen. The A positive person here has the Rh antigen. We are now introducing that Rh factor into this person's blood, a foreign antigen, something they've never seen before. So upon the first transfusion of Rh positive blood to an Rh negative person, there is a slowly building antibody reaction. So we're going to give this person some Rh antibodies, or antigens rather, on their blood cells over here. This person will start building these Y-shaped antibodies in response to this foreign invader. Because this is slow for our bodies to recognize and react, the reaction here is mild because we are dealing with the first transfusion. Okay, so it takes time for your body to recognize the invader. It takes time to build those antibodies against that foreign invader, which is that Rh positive antigen, something foreign to us. Here's where the real problem comes, the second transfusion. Upon the second transfusion, this A negative person already has antibodies in the bloodstream that are built against that Rh factor. So along comes the second transfusion of A positive blood. We're going to donate again. Now we're getting these Rh antigens into the bloodstream of the negative person. And these antibodies say, we've been waiting for you. We knew you were coming back someday. So these little Y-shaped structures can bind these Rh antigens sitting on their red blood cells. Okay, and so they will agglutinate. The reaction the second time around is more severe simply because the population of antibodies has already been made. They're maybe not as great in number as initially, but your body knows now what to make in response to this foreign invader. Now, if there's an emergency, they may not have an opportunity to blood type. The most important thing is to save the life by giving that donation of a blood, whether or not it's compatible. Hopefully the blood type is compatible. Of course, O is a great choice because we know it's a universal donor, but it takes time for this antibody-antigen reaction to occur. So if they do happen to do this, they can give immunosuppressant drugs, and that will shut down this antibody-antigen reaction. So you may recall immunosuppressant drugs may be a type of glucocorticoid. We know that glucocorticoids are things like cortisol, and they have an anti-immune response. So that may be a way to prevent your body from having this huge reaction between these antibodies and these anti-Rh antigens. Okay, so this is a really important section. It is a commonly missed topic, so I encourage you to watch the last two slides here again. Let's also talk about the Rh factor dealing with pregnancy. The only time this is ever an issue is for a mom who is Rh negative. Keep in mind, Rh negatives are around 15% of the population, so the odds that you're Rh negative are pretty low. If you're pregnant and you go to the OBGYN, they will blood type you early on in your pregnancy. If in fact you are Rh negative, they give you a RhoGAM shot, at 28 weeks and again at birth to prevent your body from building antibodies against your fetus or your subsequent pregnancies. So let's say that this is mom's first pregnancy. She will slowly build antibodies against her fetus. Think about this. Mom is much bigger than her baby, okay? So mom is pregnant with her baby. Her baby is tiny compared to her. Mom has much more blood than her baby has. So because the baby is the smaller of the two here, then mom's body will fight against the baby's Rh antigens. Notice the first exposure of Rh blood, mom's going to build the antibodies slowly. This baby may be born with mild problems, not necessarily a stillborn birth or anything like that, but the body has been now primed with anti-Rh antibodies. So that's why it's very important for mom to receive this RhoGAM shot, because if she's pregnant again with a positive baby, she may be more quick and responsive to those Rh antigens. All right, so let's assume that mom does not have immunosuppressant drugs. Let's assume she didn't get this RhoGAM shot here. Upon the second pregnancy, we are going to assume that Rh negative mom has another Rh positive baby. This time, mom's antibodies are already present, they've already been formed, and they're ready to fight the Rh antigens on the fetus's blood. The second pregnancy is a more severe response. This time, there is going to be agglutination of those mother's antibodies against those fetuses' Rh antigens. All right, so before we look at the name of this condition, let me just mention, if mom is Rh positive and the baby is Rh negative, there is no reaction, okay? That's because baby is tinier than mom, and even if the baby were to form anti-Rh antibodies, mom has a lot more blood, baby has a lot less blood. So keep in mind, if you're an Rh positive mom, then you've probably not heard of the RhoGAM shot. It was not an issue for you. All right, so if you have an Rh negative mom and you have a second pregnancy of an Rh positive baby, then you may form what's called hemolytic disease of the newborn in that baby that's just born. This is called erythroblastosis fetalis. Boy, what a name there. And unfortunately, what happens is the fetus's red blood cells may rupture thanks to the red blood cells being agglutinated by those Y-shaped antibodies. So keep in mind, they will cross-link, and that can cause quite a mess as those cells rupture. So again, the disease results when mom is Rh negative and the fetus is Rh positive. You can see agglutination or clumping of red blood cells here. Keep in mind that capillaries are only the size of a red blood cell, so imagine that huge clump traveling through the capillaries of the baby's body. And you can see some of these cells here have ruptured. We call that rupturing, hemolysis. So first pregnancy, problems for the fetus may be mild. However, for the second pregnancy, because antibodies have already been formed, there may be a much more severe reaction for this fetus. And that's when we tend to see these much more severe reactions, such as hemolysis of those red blood cells. Imagine back in the day before we knew about this. We've only known about this for pretty much the last century. Imagine mom having one Rh positive baby. Everything was fine during the first pregnancy. And imagine every pregnancy after that might have been a stillbirth or miscarriage. They probably did not know that they were just simply dealing with an issue of antigen and antibody incompatibility. Now, if you have page 31 handy, let me walk you through the blood chart there. I would not recommend memorizing this chart. Instead, I would recommend working on the practice problems on page 32. And yeah, there's 50 of them there until you feel comfortable. I would also recommend using some of those games on the Nobel Prize website or on Red Cross website to help you get this stuff straight. If come test time you are still having to refer to this chart, you are not yet comfortable enough with this material. You want to be able to wean yourself off this chart, wean yourself yourself off of flashcards and be able to talk this out without having to reference either flashcards or the chart. All right, so let's talk about antigens. We are going to combine the ABO blood groups and the RH blood group here and talk about them as one blood type. I'm going to work across the rows here. I'm going to do A positive first. A positive means the person carries the A antigen and the RH antigen. There's only one other antigen this person could have had, and that would be the B antigen. So it would be foreign to this person, so this person will form anti-B antibodies. Now here's the trick. Who you can receive from must have some compatibility with your antigens. Obviously you can receive from yourself, and you can receive negative blood. Positive blood can always receive negative blood, especially if the ABO blood groups are compatible. What other blood type can be given to A positive blood? How about O positive and O negative? Why can't we get anything with the B antigen? Well, it's because we would carry that anti-B antibody. Now, let's say that you're A positive, you walk in the Red Cross and you say, I'm here to donate blood. I'm curious, who could my blood be given away to? Obviously, you can give it to your own blood type, and you can give it to a B positive. You cannot give your blood type to anybody who is negative, because you'd be introducing an RH factor or antigen that's foreign to them. You also can't give your blood to anybody who's O, because now you'd be giving them an A antigen that is foreign to the O person. So that's it. We can give our blood to A positive and AB positive. Let's talk about the next one, A negative. The only antigen this person carries is the A antigen, but this person has two things foreign to them, the RH factor and that B antigen. So two antibodies here that they would carry or potentially form. The A negative person can only receive blood from the A negative blood and from O negative blood. Why can this person not get blood from A positive? It's because this person would form anti-RH antibodies against that positive blood. All right, so this sounds like a joke, right? A negative walks into a bar, but, well, A negative walks into the Red Cross, wants to donate blood. They can, of course, give it to themselves. They can give it to A positive blood. They can also give it to AB negative and AB positive. When you're thinking about this last column of who we can give blood away to, we're not giving anything foreign to these blood types. All four blood types listed here have seen the A antigen, and that's critical. Let's talk about B positive blood. This person carries the B antigen and an RH antigen. The only antigen they haven't seen is A, so of course they would form anti-A antibodies. This person would receive blood from B positive. What else? B negative, O positive, and O negative. All right, so B positive is ready to donate blood. They can give it only to B positive and AB positive. So you're probably getting the routine by now. This B negative person has only the B antigen. They would form anti-A and anti-RH antibodies. They are limited in what they can receive, only B negative and O negative. But of course the blood bank says, well, we can use your blood for four types. B negative and B positive, and what else? AB negative and AB positive. Okay. Let's talk about AB positive for just a minute. This blood type has the A antigen, the B antigen, and the RH factor. It carries no antibodies. This blood type can receive blood from all blood types. That would be A positive, A negative, B positive, B negative, AB positive and negative, and O positive and negative. However, the only blood type this person can give away to is their own blood type, AB positive. Okay, so in terms of using their plasma, this one, of course, has no antibodies. This would be great because there's no antibodies here to trigger an agglutination response in the recipient. AB negative carries the A antigen, the B antigen only. If triggered with sensitivity, we would form an anti-Rh antibody against an Rh antigen. This person can receive all the negative blood types, of course, A negative, B negative, O negative, and AB negative. Okay, and then last here, they can give blood only to AB negative and AB positive. All right, you can't give this blood type to A, B, or O because you would then be introducing an antigen that is perceived as foreign. Let's talk about O positive. The only antigen here is what? Rh. The antibodies this person probably forms, anti-A, anti-B. Okay, this person can receive blood from O negative and O positive. That's it. Okay, and of course they can give blood to anybody else who's positive. So that would be themselves, A positive, B positive, and AB positive. Okay, so just a thought here. Of course, we know that O positive is your universal donor, and AB positive is your universal recipient. So I'll just put little tiny notes there. Now, if you're donating away O positive blood, well, this is actually your better. Your O negative there is your better one, so let's erase that. But let's just say that we're using O positive blood to give away to any of these 4 blood types over here. Okay, so if you were to give away that blood, you may be transporting with you some anti-A and anti-B antibodies. If we're talking about a whole blood transfusion, you may be giving the A person anti-A antibodies, or the AB person both anti-A and anti-B antibodies. So when we talk about O being a great donor, you know, truly you have to think about these small risks of carrying these antibodies in the blood plasma. Now, the recipient, the person who's getting this blood, in this column over here on the far right, there's little risk for them long term because the liver will eventually break down and remove these antibodies that are coming in the donor's blood, and there's not a long-term issue for it. The real hope here is that we're going to save a life by having a blood transfusion, but this is just a small risk to take into consideration. Okay, so finally we have O negative. There are no antigens here. This person may fight anti-A, anti-B, and anti-Rh. Almost out of room. They can receive from, oh wow, O negative, that's it. But great news, they can give to all blood types, right? Okay, so everybody would like to have O negative blood, especially if you're talking about the red blood cells, because there's no antigens on their surface. Again, if you're talking about whole blood donation, here's the concern. If your blood type is A, B, AB, you may be receiving the anti-A, anti-B, or even the anti-Rh antigen, antibodies in the blood. So let me mention this. Anti-A and anti-B antibodies are naturally occurring in those bloods who do not have those antigens. However, it takes a transfusion or pregnancy to sensitize you and form those anti-Rh antibodies. So if you've never been pregnant, or if you're not an Rh negative person, or of course if you are a person who's never received a transfusion, that's not going to be an issue for you. All right, so practice through this worksheet. I encourage you to print out a separate one, make a nice clean copy for yourself, and then get to work on page 32 with those practice problems. Please let me know how I can help you with this content.